Morning, everyone. How's everyone feeling? Okay, very good. So I'm here to talk about CLIMB-TRE, which means Trusted Research Environment. It's a way that we can have an infrastructure to survey pathogens and other types of data across the UK. So we started working on this. This is sort of like a successor project to our work on CLIMB-COVID, and I say us. I actually joined in 2021, so really I'm taking credit for work that other people did. But in the UK, we had a really successful SARS-CoV-2 surveillance infrastructure called CLIMB-COVID, and to date, we've sequenced and integrated the 3.5 million sequences into the dataset. And we did that by having a really integrated across-the-country network called COG-UK. And our CLIMB-COVID infrastructure was very successful. It was hosted at the University of Birmingham, and almost all of the UK's COVID sequences came through here. So the way it worked was that sequence providers would upload to CLIMB-COVID, which is a big virtual machine hosted at the University of Birmingham on the CLIMB infrastructure. It would be then, they would use SSH to send it up. It would then be checked and compared to the metadata database, Majora. And then if it passed QC, it had the right metadata, all like that, it would be integrated into the main dataset, presented, and uploaded to external databases, used to inform external tools, and things like that. I originally had like specific names here on this slide to sort of communicate who did what, but there's just too many people involved and it wouldn't have been right. So I've got the COG-UK big authorship list on a QR code there if anyone's interested. But I would like to make specific mention of Sam Nichols, who did most of this, who's around here somewhere. Radislav Poplovsky, who was our systems administrator, Matt Bull, Anya O'Toole at the University of Edinburgh, Rachel Colquhoun as well, who's at the University of Edinburgh. They did so much good work and spent a lot of sleepless nights, a lot of very long days getting this working in 2020. So when we set up to look at a successor infrastructure to CLIMB-COVID, we had a sit-down meeting with me, my boss, Nick Lohman, and Tom Breyer, who's also here. And we said, right, so what worked about CLIMB-COVID and what didn't work? So first, MQTT messaging or event-driven design was really successful. So the way this worked was the ingest pipeline, ELAN, would kick off on a timer every morning, and it would then do all of the QC, check everything, present the data, so on and so forth. And then other people could listen to that. They could set up their pipeline to say, I want to run when ELAN is finished, when all the new data for the day is there. It would then pick up that message, run, and then other people could kick off pipelines in response to that pipeline. And anyone could access this on the infrastructure. So that was really cool and worked really well. Then, next thing, command line dataset access. Having all of the data on one file system, which was CephFS, was really powerful. Users could just look at the big line list, say, I want to look at this data and have access to it right there. Because especially in a sort of trusted research environment type model, it's really important that users don't take data off the platform because they're really not supposed to. Well, not in all circumstances, but certainly with CLIMB-COVID, we didn't want users taking data off the platform that they weren't allowed to take off, specifically metadata. So having it all on one platform encouraged people to not do that as much as possible. And people did, but you know, you can never stop people doing stuff entirely. Then Majora central metadata bit, and that we did use that logo, by the way. I still keep expecting that we're going to get sued by Nintendo, but it hasn't happened yet. So, you know, YouTube, please don't sue us. So having this big central metadata database where the users could tag samples with arbitrary metadata, they could provide metadata prior to uploading samples from Ocarina. There was a big theme to this, you might notice. Using Ocarina to, say, expect the sample prior to getting uploaded. The downside was that over time it got unfortunately quite slow, and it wasn't really set up for doing single sample metadata. So if you wanted just one You know, if you just wanted to say, oh, I want the metadata for this sample, it wasn't very good at doing that. It could, but it wasn't very good. So it became unwieldy over time, but it still works, and the website is really, really, really solid and still used today to do the authentication for CLIMB-COVID. Then, Nextflow, I had to mention it. So most of our pipelines are done with Nextflow. I think there's a little bit of snakemake still, but I think that's mostly been retired. And yeah, Nextflow pipelines run ELAN, it ran DataPipe, which presented data to the outside world like big S3 dumps of the data set. PhyloPipe, which built the big tree, everything like that, all ran on Nextflow. So yeah, Nextflow was a big success, so we wanted to make sure we did that as much as possible. So we came up with a set of 3 design principles. So first, we're going to exploit the new CLIMB model. So the old CLIMB model was that we're effectively sorry, I should probably explain that. We're a cloud provider, effectively. So it's cloud infrastructure for microbial bioinformatics. So we've got a lot of compute in a couple of universities across the UK, but mostly now in Public Health Wales and the University of Birmingham. And that we previously let users, they would log into the website and they could say, I want a virtual machine, and it would 8 cores, 64 gigs of RAM, whatever. And then they would have that, access to that for a while, they could do whatever they wanted, they could do analysis on our infrastructure. And that was really powerful, very flexible, but it's also extremely inefficient, because if someone has a virtual machine span up with 8 cores, you know, if they're not running analysis at any point, those CPU cores are sat there doing nothing. So, well, maybe not nothing, but not very much, and it's not very efficient. So we wanted to use that as much as possible, by which we have a big Kubernetes cluster, which is now most of our compute, and we allow users to access Jupyter Hub in the cluster. So they say, I want a notebook, well, a notebook server. It will then kick off with a certain amount of compute, and they can, if it's a small analysis, they can just do the compute in the notebook, in the terminal of the notebook, or they can use a Nextflow pipeline, like an NF core pipeline, which is totally compatible with this, which will then just automatically use Kubernetes to scale to whatever they need to do based on how much quota they get, based on how much they pay for, really. And that's really seamless. And I think most users don't even realize they're using Kubernetes, which is, I think, good, because you say Kubernetes to bioinformaticians and they get quite scared. So then next, keep things event-driven. MQTT was good, but it's not really versatile for what we want it to do. You can't do user control very well. You can't say, I want this user to be able to access this set of queues and not this set of queues and things like that. So we need to use something else. So I use RabbitMQ. Varus is a little client program that I've made for talking through RabbitMQ, and then Roz is my personification of all of my sort of data plumbing pipelines. She's called that because in Monsters, Inc., the slug lady is like an officious bureaucrat that loves saying no, and that's what I do. As soon as someone's metadata comes in and it's not right, I say, no, get rid of it. So that's why she's called Roz. Then we're going to keep it as general as possible. Onyx is the successor metadata database that Tom Breyer wrote. It's really good. It's extremely fast, and it's much better at doing single sample metadata. And then Bryn is our web front end, designed by Andy Smith, which is also really good and allows access, user control, two-factor authentication, everything like that. So it's kind of like the gateway into the whole infrastructure. So this is the sort of model we settled on. It's quite simplified, but what users do is that they have a specific bucket that they have access to, an ingest S3 bucket. It's hosted on our infrastructure, by the way. It just uses the S3 API. And they can upload a set of data. So, for example, in our metagenomics project, they upload fast queues and a CSV. So the metadata always lives with its data, which is really important, because we found a big issue in CLIMB-COVID is that we ended up with all of these huge number of metadata records which don't link to anything, and it was a bit of a nightmare. So it always is stuck together throughout. So then that triggers off messages, events, which say, oh, we've got new files, do they match the spec? Yes, no. And if they do, it gets passed through to a custom Nextflow pipeline per project. So the Nextflow pipeline then does QC, it process the data if it needs to be processed. You know, in one of our projects, it's assembling bacterial isolate de novo. In others, it's doing taxonomic classification, whatever, really. So if we were doing something more akin to CLIMB-COVID, where it was just a single pathogen, and we wanted to do QC, it'd be like things like coverage metrics, maybe some lineage assignment, stuff like that. And then we put data into published data buckets, which will be restricted to only who needs to see them. So people who are in the correct projects, sites even, you know, we might want to restrict it so that people can't see stuff outside of their own site at some point. So as an example, MScape is our current project where we take clinical metagenomics respiratory data from, it's supposed to be hospitals around the UK. We actually haven't got that yet, but we're hoping over this flu season that'll really ramp up. We're collaborating with the UK HSA, which is our public health agency in the UK. And really, what we want to do is make sure that if virus X, I'm sure you've heard a lot about virus X, emerges in the UK, we want to be able to make sure that we can spot it as early as possible. So that's the really sort of big idea behind MScape. So here's a small video showing off Tom's GUI. Can I get it? Yes. Where you can just see, this isn't real data, by the way. We can just see that they can just log into JubeTub, and this isn't a website. This is a JubeTub extension, and it just talks to the metadata of the database, grabs the data using the user's own credentials, and you can just click on reports where it summarizes. This might look familiar to the Oxford Nanopore people because we slightly borrowed the Sankey code from them, from workflow metagenomics. Again, synthetic. No, we haven't spotted someone in the UK with Ebola, despite what that says. Yeah, the idea is that what we really want to do with this is to make sure that if a COVID-like situation happens again, we don't have to spend 6 to 12 months working extremely long days, sleeping very little, like all of the CLIMB-COVID people did, and that we can spin it up quickly. And we think that we've got that now. So I'd like to credit everyone here, and especially, as I said, Sam Nichols, who's now Oxford Nanopore, for all of the development work he did on CLIMB-COVID and for looking after me when I was very green and just starting out. So yeah, thank you.